the speech on Wednesday night?
Well, I think we simply heard a little more detail, particularly a number of my colleagues and I continue to express concerns about making sure that the health care proposals are paid for, not just within a 10-year window, but in the out years as well. I think we also recognize, though, where perhaps some of my Republican colleagues don't fully appreciate that, the price of doing nothing. If we don't take on health care reform and get it fixed, we're going to continue to see the deficits explode because Medicare and Medicaid is driving the deficit cost more than anything. We're going to see people's insurance premiums double. We're going to see American business become less competitive in a global economy because we got to pay $3,000 or $4,000 more per employee than any of our competitors around the rest of the world based simply on healthcare costs. So we've got to drive our healthcare costs down overall, not just within governmental spending, but within everybody's spending. And I think the president's committed to trying to work with us to see that happen.
Is it clear in your mind that the public option will not be part of the final bill?
Listen, I think that I have expressed throughout this debate concerns about simply expansion of a government program that really doesn't do much about driving our cost curve down. I think the president continued to express his support for public option, but left open the fact that there are other alternatives out there. At the end of the day, what we need is more competition in the healthcare market. We don't really have a free market system right now in healthcare because we don't have good transparency in terms of data about what things cost, about what the insurance companies charge. We need a healthier, more competitive, robust market, and there's a lot of ways we can get there.
And Senator, in your home state of Virginia, there's a hot and heavy gubernatorial race going on, and the Republican candidate, Bob McDonnell, yesterday, just a day after the president's speech to the joint session, attacked the Democratic candidate, Creed Eads, and talked about this as a job killer plan, and asked him to distance himself from the president's plan. What's your sense? Is this a political loser right now in Virginia?
I don't think so at all. Matter of fact, the Republican has been trying to federalize this race throughout the whole cycle. I'm not sure attacking health care reform when we've got nearly 1 million Virginians without any kind of health care coverage is a smart political tactic. I do think we're going to see a movement forward on health care reform. I still hope that there'll be some Republicans that will join with us in a plan that is both drives down costs, doesn't add to our deficit, and is done in a way that increases competition for all of us who've got health care as well as those who don't. And I think trying to politicize it at the state level when it's a political tactic, I'm not sure it's going to pay off, though.
Senator Warner, you've been speaking a lot about costs. The president put a price tag on it the other night. He said $900 billion in this 10-year period. And yet, what we've seen CBO, the Congressional Budget Office, score, they're sort of the referees in this. On the House side, they said that the House versions of the bill still add some $239 billion to the deficit. The help bill, they said, is not going to bend that cost curve. So do we have to start over here at ground zero?
Not at all. I think what a lot of us, at least on the Senate side, have been waiting for is the Senate Finance bill, where Chairman Baucus has been working with some of the Republican colleagues as well as some of the Democrats on the committee to actually, I think, put out more cost constraints around health care. He's talked about things like if you can afford to buy health insurance in this country and you don't have it, just as we require you to buy auto insurance, we're going to find a way to make you require at least to buy a minimum benefits package. We're going to try to say that if you have a Cadillac insurance plan, at some point we're going to maintain the tax ability to have tax-free health care and plans up to a certain point. But if you're at an actuarial basis of, say, $40,000 per plan, that perhaps we ought to go ahead and get rid of the tax deferment above some certain limit. I think these are all pay-fors. I think one of the things that has been missing from the debate is, we spend $2.5 trillion a year in health care in America right now. There are examples of the kind of savings the president's talking about taking place right now amongst large corporate employers in America. That's really where health care reform's taken place over the last 5 years. And I think we need to engage some of these large corporate employers who've actually driven down their health care costs as examples of how we, within an overall systematic plan, can drive down costs as well. And I'd like to see more of that activity in the debate.
Senator, I want to turn your attention to Afghanistan. I'm sure you saw the remarks by Senator Levin today, where he says he opposes the addition of more combat troops to Afghanistan. Is President Obama really going to be out on his own if he goes forward with more troops? Is the support just not there right now in the Democratic Party?
No, I think we need to wait to see what the president says, what the recommendations of the commanders on the ground are. I was in Afghanistan in the spring, and clearly my sense was that one of the things that's unique about the Afghan situation, clearly the Taliban is a challenge, but the Afghani people hate hate the Taliban. They've seen what happens when the Taliban control the country. And the Afghans, perhaps unlike the early days in Iraq, the Afghan army is prepared to fight and be good colleagues. We heard that time and again from our American troops and some of the other NATO-inspired troops. And I listened to Senator Levin today. He raised some concerns, but I think he brought out these same points on his recent visit, that the Afghanis are ready to fight. We simply need to make sure that we speed up the Afghanization of the war.
But how about more American combat troops on the ground there?
Listen, I am going to wait to hear what the president has to say, wait to hear what General McChrystal has to say, and I think before I weigh in on that, I want to hear what the commanders in the field and their recommendations.
Senator Mark Warner, Democrat of Virginia, thank you so much for being here today. We appreciate it.
Thank you.
We'll let you get back to presiding over the Senate chamber. That other
yeah, thanks for taking a break. We're going to take a quick break. George Stephanopoulos of The Bottom Line.